So I am a physical therapist, but I specialize in lymphedema, lipedema, and pelvic floor dysfunction. So I originally got the MedWave neuro for endometriosis to help with all of that, which just it's fantastic. It's got the red light with the red, which is going to help with regeneration and all of the hormonal side of things and the serotonin and the dopamine and the infrared to help with all the pain. But as I'm researching more and more into what red light therapy really can do and how this one goes deeper because of the lymphatics side of my practice, I
Yeah.
really wanted to try using this with my lymphatic patients, my lipedema, my lymphedema patients. In fact, especially with the contour, I kind of realized that you guys are probably treating lipedema without realizing it anyway. And once we get into the near infrared light waves that are there, that's helping so much more with all of the inflammation, which is really what those conditions are. They're inflammatory by nature, was when I just kind of started trying some things out. And especially with the vibration plate it comes with the light, because vibration already helps with lymphatics anyway. My patients were feeling so much better in ways that I couldn't just do on my own. The lipedema side, I was really interested in because I know that it's going to unlock the fat cell contents. And because with lipedema, what it is it's not it's not normal obesity. It's not normal fat cells. Under a microscope, they look different. They behave different
Yeah.
than typical fat cells. So anything that we have that can help basically attack it, the better. And it's just such a painful condition, and it just helps so much more with their pain. It helps more with them being able to tolerate their compression. It helps being able to tolerate exercise, which is all of the things that's going to help them feel better. So though with my lipedema patients, especially because we're working on this track, a lot of them are looking into surgical options. I have several they have surgery planned. It's upcoming to for surgery for their lipedema. And I've told all of them, make sure that you tell your physician, your surgeon, you have to come back here immediately. And I want you under the light, like post-op.
Yeah.
Immediately. It's gonna help it heal so much faster.
That's awesome.
But the really cool one too is my lymphedema patients. So these are like cancer-related lymphedema. And I've had several, one lady in particular who I've been seeing for years and years and years. She's super stable, but if she doesn't see me, she just kind of gets worse. So I always just kind of do lymphatic drainage on her. She just kind of always stays the same. She's got this fibrosis in her foot and ankle. It just never goes anywhere. And I treated her with the light just once, the first time I treated her with it. And she lost 1.5 pounds in one day that stayed off for
Wow.
over 2 weeks. It was all fluid. It was amazing. I couldn't believe it.
So tell me a little bit, what are your patients' response to this? When they have these treatments, how do they feel afterwards, and how do they, experience this technology in your office?
Oh, they love it. They're so happy. Like, it's the first thing, because I'm usually still in the room with them just because of my current clinic is I'm actually outgrowing it at this point now. It's been kind of cool, but I'm in the
Wow.
room with them. I'm talking to them. I'm usually educating them while they're lying under the light. And the first thing is they just feel so relaxed.
I would love for you to, like, before you had this device in your practice, how did your treatments look like, and kind of what does it look like now?
Yeah.
And yeah, how has it impacted your practice?
So before I actually didn't. So I have a private practice, and I still work for my hospital day job. I see most of my lymphedema patients through the hospital because insurance and stuff. But a lot of people are looking more for maintenance. Once they're done, they just they want lymphatic drainage just to kind of keep them going. So those maintenance patients, they come in, and typical before I just kind of do lymphatic drainage for an hour and they feel better and they leave, and they come back, and we just do this, once a week to once a month. And so with the light, immediately it becomes apparent that this is a membership. This is absolutely a wellness membership. And so they come in, we immediately start with the vibration. We do 5 minutes of that. And then we do, depending on the patient, their general health. So some who I know are just not healthy anyway. I'm a little bit more like wary of things like detox. They do 5 minutes on each side.
Yeah.
And then I do lymphatic drainage with them still. So I kind of just, they're not flipping a whole bunch. So we'll do 5 minutes face up, and I do somewhere in the neighborhood of 15 to 20 minutes of lymphatic drainage. I spend a lot of time focusing on the abdomen because everything is draining through the belly. And if they're any kind of congested in their abdomen, they're just going to actually immediately getting off the light, and I've measured, they actually get more weight. Well, not weight, they get more inches. So like with the contour, it's always like, oh, they're losing all these inches immediately, and it's super cool. With my patients, these lymphatic patients, they're not losing those inches immediately because it's all still draining. Their
Yeah.
lymphatics are impaired, they're slower, so they actually look like they're bigger immediately. So I spend a ton of time working on their abdomen to make sure everything flows. So we do that for 15 or 20 minutes, and then I have them flip. We do 5 more minutes with the light, and then I do lymphatics on the backside of their body. And then they get off, they do the vibration again, and then we're done. Might do like education or whatever, but that's kind of where like the vibration plate the second time, they always tell me feels easier to do. They can usually turn it up a little bit, or they're just like they're doing more of the squats, or we're just kind of doing some different movements there, but they always feel good,
Yeah.
just better, happy, whatever it is, and
Yeah.
like lighter always, and like less pain always, but just feel good. I actually have another patient. I just tried it on for the first time. He's very, very complex patient. Lots of trauma. So this is a pelvic floor patient. Lots of sexual trauma when he was a child. Lots of pain. Lots and lots of pain and scar tissue in his pelvis. Um, it's been weirdly migrating into like back pain and like numbness, tingling in his whole body. And there's like psychological things that are contributing to his pain at this point. We're all pretty sure. And this was last ditch. I'm like, I don't know what else to do for you. I've done all of my things. You kind of feel better for a bit, but this back pain is killing you from doing anything. So I was like, just come try it. Just come try it. And all I did was vibration and the light on both sides and vibration again. And not only did his demeanor change immediately, like he was like looking down at the ground, very, very like obvious depressed affect. And immediately after, he smiled. Like, I haven't really seen him smile in weeks.
Oh my God,
And
that's
so he
amazing.
felt good when he left, and I was encouraged. And then I saw him 3 days later, and not only was he still smiling, but exercises where he couldn't add even the smallest amount of weight to basic, like, getting up out of a chair kind of exercises, he was able to do with some pain, and then after finishing the exercise, he had less pain. I couldn't believe it. It was astounding, like, insane, the
That's
change
such a
in
great
him.
story. I'm welling up here. That's awesome.
It was
Having
I
impact
I
on
can't believe it.
the health. No, that's amazing. Have you been under the light yourself?
Oh, yeah. Oh, yeah. So, I mean, luckily, I don't have, any pelvic floor issues right now or anything like that, but and so I don't have the contour, so I don't have all the red ones, but I've definitely noticed just, like fat loss,
Yeah.
like, for sure, which was really cool, and actually, I've had it for 2 months or so now. Within 4 or 5 weeks, for some reason, all in the same week, 3 separate people, unsolicited, gave me compliments on my skin. So that was
Amazing.
fun,
That's awesome. That's so good.
but I'm
Um,
not upset about it.
yeah, no, that's really cool. One thing that I'm also curious about is that you've got a shockwave machine as well, right? The SoftWave.
Yes. Mhm. Yep.
How do you combine these two devices, and when do you use the shockwave? When do you use the MedWave? Do you combine them? How do you utilize it?
Yeah. Oh, that's another new one I just tried with the light, which was really cool. So the SoftWave I use for more local issues, right? So because it's very localized. Primarily I'm using it on pain, but I do have some that I'm using it on scar. The ones that I've been using it more on scar tissue, I find that the light is a really, really good pair for it. Actually, I have a patient who has lipedema right now who I'm using both because she's lipedema, but she had had a lot of skin removal surgeries after weight loss,
Yeah.
and the scars are really gnarly and causing her a lot of pain. So the SoftWave has been really able to target a lot of the like more like nodules and fibrosis.
Yes.
She's not your typical lipedema patient. She's very, very, very active and very, very, very healthy. So I think she's got a better response to the SoftWave than like someone else might at this point.
Yeah.
But my pelvic patients, it's great for their pain. And I have one gentleman who I'm seeing for he'd had his prostate removed years ago and rehab and all of that. So he's got incontinence and he had gotten Botox injections to help with like spasm and urgency. And he'd had it before and it was okay. This new time he got it, he's basically way more incontinent. So he's wanted to try the SoftWave to, activate his muscles a little bit more, get more blood flow to the muscles, hopefully help the Botox get out of his system faster. I used it with him like 4 times and not really seeing any change at all. And like same thing, he's got a history of depression. And so I was like, well, you're here, the light's here, let's try it, see what happens. I don't know. We didn't even use the vibration plate with it. I just wanted to try the light too. And that day he left and said that A, smiling, normally not smiling,
Yeah.
but B, he said that like in his pelvis, he felt different. He felt like where before he felt like he could have been leaking. As he's leaving, he's like, no, I just don't feel that way anymore.
Yeah.
So
That's so awesome.
I
That's so
follow up
cool
with
to
him
hear.
today.
Yeah, it's just what
Yeah.
we've seen is that with shockwave and other treatments, what the MedWave does, it doesn't take those treatments away and shift it over. It just enhances their efficacy, right? Which is exactly what you said. So that's really cool to hear. What do you generally charge per session under the light?
So because I typically, and because I'm a physical therapist and most of what I do is manual, I love that it's something I combine with what I do. So
Yeah.
most of the time it's an add-on for me. Well, so what I will say with this is that right now, because I'm still like, I am like, this is still relatively new. I've had it for like 2 months.
Yeah.
I still have my day job at my hospital clinic 3 days a week, and I am treating private patients 2.5 days a week.
Okay.
So I am not even full time using this. And I'm already making back enough money to make payments on financing it and growing to a place where I can be on my own full
Yes.
time. So
That's
like
awesome.
the investment has really helped to grow me enough that like paying for it is something I should be afraid of, but I'm not.
Oh, well, thank you. That's incredible. Good. Well, thank you for sharing all of that, Dr. Katie. Really appreciate you jumping on
Yeah.
here. And I'm sure it's going to be super helpful for those that would like some more information and hear the real experiences for that, for providers who's got these devices in their clinic. So thanks a lot.
Yeah, absolutely.
Cool.